Story. I've been reporting on the Multnomah County ambulance response crisis for well over a year now. Ambulance provider AMR has failed to meet response time standards, arriving late to emergency calls. They blame a national paramedic shortage and the county's unique two-paramedic requirement. Their formal proposal to improve response times urged the county to temporarily change the staffing requirement to one paramedic and one EMT instead of two paramedics. Well, this morning, Multnomah County Chair Jessica Vega Pederson responded, and it's tonight's big story. I've previously called this a standoff between county EMS leaders and Vega Pederson versus AMR leadership. And today, Vega Pederson doubled down again. She rejected AMR's proposal to switch to a one paramedic, one EMT model, saying the company hasn't done enough to bring in more paramedics, even though she recognizes there's a national shortage.
AMR continues to propose changing the way we do business instead of taking the necessary steps to improve their service. I want to be clear, AMR's conduct in this crisis is irresponsible and unacceptable. They're allowing a crisis in our community to worsen so they can make more money instead of recruiting, hiring, and retaining enough first responders on staff to provide the services that they've agreed to.
So Vega Pederson says the county is moving to formal mediation with AMR. She threatened another fine, this time $1.6 million for recent months of late responses, on top of $500,000 earlier last year. She wants county experts and the Oregon Health Authority to review the current ambulance service plan. She wants AMR to subcontract, and she says moving to a one-and-one model would shift costs onto taxpayers.
Taxpayers will pay if city fire departments have to respond to more calls. And if those fire departments can't go to more calls, we'll have fewer higher trained paramedics responding and will be accepting a lower level of medical care. That is why I won't be bullied into any kind of quick fix. And the truth is that AMR is failing our community. This company hasn't provided enough ambulance service for Multnomah County families for almost 2 years. And at the same time, they've expanded into Washington County.
Okay, that taxpayer comment raises attention, but here's the issue with that. Those fire departments, Portland Fire, Gresham Fire, Corbett Fire, they're begging Vega Pederson to approve a change to a one-in-one model, saying their crews are stressed by the way the system works now. A month ago, Portland Fire Chief Ryan Gillespie wrote to county EMS leaders saying not making this change is irresponsible at best. Currently, with fewer ambulance crews on the road, firefighters are forced to wait with patients at critical scenes or transport someone on the back of a bus or a truck. That's not how the system should work. I asked Portland Fire and Rescue again today after the chair's statements and received this. The status of transport ambulances in the city of Portland is critically insufficient. Portland Fire and Rescue encourages Multnomah County EMS to pilot a one EMT and one paramedic staffing model. In situations where AMR paramedics need more help, PF&R would continue to respond with Code 3 lights and sirens to assist. Fire leaders have repeatedly said they respond to every critical call in Multnomah County, meaning they're bringing their own paramedic and other trained first responders to the scene of an emergency. But Vega Pederson says that 25% of the time, triage 911 calls are later escalated to a more life-threatening status, and fire crews aren't there. That's why she and others swear by two paramedics on each ambulance.
In Multnomah County, because of the growing 911 call volume, fire agencies in 2023 were able to respond to only 75% of 911 medical calls that were ultimately found to be life-threatening. Responding to all emergencies is not currently feasible for our fire agency partners.
So the chair is worried about potential future harm, but there is current harm right now. We covered a story on this show where a man in a wheelchair hit by a car died in the street waiting for an ambulance to get to him. It took 32 minutes for an AMR crew to get there. And the data shows Multnomah County dispatchers do not have an ambulance available to send to emergencies every single day. It's called Level 0. Last year, there were 14,774 911 calls in Multnomah County and that were Level 0 compliant. Nearly 15,000 times when the response was, well, hopefully we can get one to you soon. That averages out to around 40 times per day of those level 0 calls. AMR ambulance crews are late to about 40% of emergency calls in Multnomah County, and late means it takes more than 8 minutes to get there. When seconds and minutes matter, that's important. And AMR is down 60 paramedics, losing 2 more every month. Now, it is true that AMR has failed to meet county standards that were included in the contract they agreed to. They signed up for this. This is the company's problem. But saying hire more paramedics falls short when there are, by all accounts from everyone I've talked to, no more paramedics to hire. Saying train and incentivize more falls short when AMR currently has 32 EMTs in paramedic school on full ride $17,000 per person scholarships. And the company says it's essentially offering full rides to anyone who is interested. I talked with AMR leaders this afternoon after the chair's comments. The company says the county's response won't solve the problem or save lives. And the problem with Vega Pederson saying AMR needs to send a plan to fix this problem within the next month is that AMR just sent a plan. They did it last week. We covered it here in detail. AMR promised to fix response time problems within 3 months if allowed to temporarily staff with a one-on-one model. County EMS leaders and Vega Pederson just didn't like that plan. And that's fine. They have their reasons, pointing to medical studies, cardiac arrest survival rates, data points that support a 2-paramedic system. But in the meantime, the people of Multnomah County are suffering now. Many of you have written to us in the past saying you would rather have an ambulance show up on time no matter how it's staffed. Without quick, decisive action, some kind of compromise, a short temporary change, the harm that we fear is a bigger and bigger part of our reality. So what are you thinking about this? Do you agree with Vega Pederson's hard stance that this is purely an AMR problem and they should be the only ones responsible to fix it and they should be doing more? Or do you think there's wiggle room when it comes to that 2-paramedic requirement, considering the risk to public health that we're facing now with slow response times that are getting worse rather than better? Email this story at kgw.com or call and leave us a voicemail, 503-226-5090.